Hello, my name is Mike Schminda, and today we are showing you a new workflow designed for our IB RadTech environment. This workflow will automatically generate fractional tumor burden maps using the entire brain as the ROI. So the user again chooses the pre and post contrast T1 weighted image series and the DSC Perfusion series, selects next, and then everything else is fully automated. So this workflow eliminates the need to manually draw those bounding ROIs on delta T1 maps. Again, instead we are using the whole brain as the ROI. And then from the delta T1 map, which identifies regions of contrast enhancement, we again capture those areas that are above the quantitative delta T1 threshold just as before. We then co-register the DSC Perfusion series, use IB Neuro to generate the standardized or quantitative RCBV data, which we then classify into regions of tumor, non-tumor or necrotic tissue, and the regions of indeterminate tissue or an admix of tissue. Remember that IB Neuro does not require the manual placement of a normalizing reference ROI to be drawn on contralateral white matter. IB Neuro automatically generates quantitative output independent of scanner vendor, field strength, patient, or time point. We also have a fourth classification which identifies regions where there is enhancement but no DSC signal. This class is colored orange and is meant to identify regions of signal dropout, which is inherent with susceptibility weighted imaging. Now, because we're using the entire brain as the ROI, the FTB calculations do not apply. As you can see, there are regions that have the standardized CBV applied that are outside the enhancing region, such as normal and healthy vasculature and some areas around the skull. However, some of the early feedback we received suggests that this is helpful and beneficial when doing diagnostic interpretation. But as you can clearly see, the same quantitative classifications within the enhancing region are there and provide the same benefits, such as guiding surgical biopsy, monitoring treatment response, and making visual interpretation much faster and more objective. If you're interested in giving this automated FTB workflow a try, please contact us at info@imagingbiometrics.com or 262-439-8252.